Good morning. Thank you all for being here this morning. This is an exciting week for HCA Southwest Virginia. My name is Victor Giovanetti. I have the pleasure of serving as president of HCA Southwest Virginia. Joining me today for this important announcement, one that we certainly believe will be part of the history books for our market. First, Greg Madsen, Chief Executive Officer of Allegheny Regional Hospital. Scott Hill, Chief Executive Officer, Montgomery Regional Hospital. Mark Nichols, Chief Executive Officer, Pulaski Community Hospital. As many of you know, HCA Southwest Virginia has experienced significant growth over the past 3 years, which parallels with our decision to create an integrated healthcare delivery system. We believe a number of factors have contributed to our growth. First is the development of our integrated healthcare delivery system model. Our patient care facilities are now closely aligned with physicians and staff, coming together as one team to identify ways we can continually improve patient care and patient access. Service line teams are sharing best practices and developing protocols that will provide the best possible outcomes for patients. This also ensures patients have access to the right physician, the right facility, at the right time. Secondly, we're reaching new heights in clinical excellence and consistently rank among the top in the nation for patient care. As a result, our volumes have grown significantly. Simply put, patients want to go where they receive the best health care. And quite frankly, physicians want to practice at hospitals where they can provide the best care. Thirdly, our philosophy of viewing physicians as indispensable partners has contributed to our growth. Many more physicians, both employed and independently practicing physicians, are choosing our health system for their patients because it allows them to choose an affiliation model that best meets their needs and their practice preferences. In the past 3 years, we've grown through the startup of new practices like the recent opening of our Lexington multi-specialty clinic, the addition of several established practices whose physicians have chosen our employment model, new affiliations with independently practicing physicians, and the opening of new outpatient centers. Today, our health system stretches from Allegheny Highlands and Rockbridge County to the Roanoke and New River Valleys and includes 4 hospitals, 6 outpatient centers, 2 cancer centers, and affiliations with nearly 700 employed and independently practicing physicians. In addition to the hundreds of thousands of patients we treat who live in Southwest Virginia, we also care for hundreds of patients who live in neighboring counties and states that reach far beyond our physical facilities. Again, as more individuals and businesses in our community learn about the level of high-quality care that our 4 hospitals and affiliated physicians provide, the more they're selecting our health system for their care. With our significant growth and our commitment to an integrated healthcare delivery system model, we began a plan 18 months ago to increase the public's awareness of our health system's true depth and breadth. That's because we are finding through consumer research that the public in general is not aware of the size, scope, and expertise that our health system offers and the public values. So today, it is with great excitement that I introduce you first to our new regional brand name that we believe will clearly and strongly link all of our HCA-owned assets and more effectively symbolize our health system. The LewisGale Regional Health System. When patients and businesses and individuals in our community see this name, they'll know it represents our 4 hospitals, 2 cancer centers, our 6 outpatient centers, and 700 independent and employed physicians. They'll know it represents nearly 70 primary care facilities that patients can access for health care, along with dozens of additional locations where they can seek specialty care. Secondly, while LewisGale Medical Center will retain its current name, except the combining of Lewis and Gale into one word, our other 3 hospitals will adopt the new LewisGale Hospital name, with each having its own geographic identifier. We've chosen to combine Lewis and Gale into one word as another symbiotic representation of our multiple facilities and hundreds of physicians joining together into one health system with a single priority, putting our patients and their families first. We'd like to first unveil LewisGale Hospital, Montgomery. Secondly, LewisGale Hospital, Pulaski. Third, LewisGale Hospital, Allegheny. And finally, LewisGale Medical Center. Likewise, all of our 135 employed physicians will adopt the LewisGale physician name for their practices, which includes 26 locations from Allegheny Highlands and Smith Mountain Lake to the Roanoke and New River Valleys in Wythe County. Again, each practice name and logo will include a unique geographic identifier, and a complete list is included in your press kits. Our Regional Cancer Center in Pulaski, currently known as the New River Valley Cancer Care Center, will now be known as the LewisGale Regional Cancer Center, Pulaski. Lastly, all of our outpatient imaging centers will also adopt the LewisGale name. I would like to take a moment to tell you about our choice of the LewisGale name. It didn't take us long to conclude it was the best and the only choice. LewisGale is a very trusted name in this region with significant brand equity. Its heritage dates back more than 100 years when Dr. Lewis and Gale began caring for their neighbors and started the original LewisGale Hospital. And it's a name that comes to consumers' minds when asked about health systems in this region. It is a name that links our health system to two physicians who had a significant impact on the high-quality healthcare choices we enjoy and need to protect today in this region. Our new LewisGale Regional Health System branding strategy will go a long way to increase the awareness of our health system among the communities we serve, with 38 facilities branded with this name, and certainly many, many more to come in the near future. Of course, there are an additional 550 independently practicing physicians who are also affiliated with our great health system. Collectively, these physicians provide access to our health system with more than 160 practice locations throughout Southwest Virginia. I would like to take a minute to emphasize our commitment to the independent practice of medicine and how these independent physicians fit into and are an integral part of our health system. Even though they have their own independent practices and unique practice names, we consider both independent and employed physicians as indispensable partners and place a high value on the rich diversity that the combination of employed and independent physician affiliations offers our system and, more importantly, offers our patients. We support and we believe in a structure that allows independent physicians to be a part of our health system. And as a team, we are proving right now that this model can accomplish all the clinical milestones that any organization in the business of healthcare, regardless of their preferred model, must achieve to be a viable healthcare provider now and in the future. First, the delivery of high-quality, cost-effective care. Second, treatments that are evidence-based, resulting in best health outcomes for patients. And third, one that embraces the patient-primary care physician relationship, as well as employer and community initiatives that focus on prevention and lifestyle behavioral modifications. To conclude, I'd like to address the most important issue, and that's how this will affect our patients. Between now and the end of the year, the public will see new signage installed in all 4 of our hospitals and all of our outpatient centers and physician practices. They'll also see a gradual transition of new patient forms, including patient care statements and insurance notifications between now and early next year. Other than getting used to the new name, LewisGale, all of our facilities and patient care forms, the name change will be seamless to patient care, and patient care, the outstanding patient care we are known to provide, will be business as usual. On the other hand, patients will benefit greatly by having a better understanding of the size, scope, and expertise that our outstanding system has to offer. By choosing physicians and patient care facilities that are part of the LewisGale Regional Health System, patients can count on continuous and coordinated care by a healthcare team working collaboratively to provide the best care and to maximize their health outcomes. At this time, I would like to ask Dr. Rodney Poffenberger, one of our affiliated independently practicing urologists with the Jefferson Surgical Clinic, to join me at the podium for a few remarks.
Thank you, Victor. Good morning. I'd like to welcome everybody here. Thanks for coming. My name is Dr. Rod Poffenberger, and I'm a urologist with Jefferson Surgical Clinic, an independent practice in the Roanoke Valley. I'm proud to be affiliated with the new regional medical healthcare system because of our shared commitment to provide the best possible outcomes to our patients. I value our long-standing relationship with this healthcare system because it supports a structure that allows physicians to maintain their independent practices, yet still be a part of a healthcare system. I'm happy to know that I've been connected to the healthcare system that fosters collaboration amongst doctors to ensure that patients receive coordinated care no matter what their healthcare issues are. For nearly 20 years, I've been performing procedures at LewisGale Medical Center. I've always been impressed with the level of healthcare facility. I look forward to continuing this relationship and working with LewisGale Regional Healthcare Center in the future and to offer high-quality care here in the community that's focused on patient care needs to ensure that they have the best healthcare outcomes. Thank you very much.
Thank you, Dr. Poffenberger. It's now my pleasure to introduce to you Dr. Daniel Osamani, an interventional cardiologist with LewisGale Physicians.
Thank you, Victor. Good morning. My name is Dan Osamani. I'm I guess I represent one of the employed physicians. My practice is in Blacksburg, Virginia. It resides at 801 Davis Street. It's known as Valley Cardiology today, but soon we'll have the name change to LewisGale Cardiology in Blacksburg. We're excited about the change. I think the change will make it easier for my patients to realize that I'm connected to a vast healthcare network. This can offer further continuity of care with hundreds of specialists throughout the region ready to meet their healthcare needs. I believe that the name change will have a significant impact on helping the public realize that LewisGale is a healthcare leader in this region with dozens of practices and locations and hundreds of affiliated physicians. As a cardiologist, I can tell you for years we've depended on LewisGale for higher levels of care, primarily for heart surgery and complicated heart procedures, and this has been seamless but somewhat invisible. I believe that now with the name change, it'll be clear to the patients in the New River Valley that we are just part of a vast healthcare network and that we can offer them the best care and intensity of care. Thank you.